So Prime Minister Justin Trudeau has recently announced that his government is going to put out a promise tracker. Well, here's one that may have already been broken. Last week, Sarah Hanlon, our medicinal marijuana columnist, wrote this great piece in 24 hours about another Liberal lie. So tell us all about that.
Well, so they came out to say that the tax, we have now the tax information on the soon-to-be recreational market, which, okay, we all saw the tax coming on the rec market, but what we didn't see was that they were going to throw an extra tax on the medicinal cannabis patients, which already are hit with HST, which is unfair because most prescription medication is not taxed. So we didn't see this coming, and they promised, I have clips, I have Vice, media clips. I have him saying to people in their face that Justin Trudeau will not change the medical system at all. He said that they will not refine it, that they will not reduce it, that they will not remove it, and this essentially is demolishing it, because who's going to go through the rigmarole of getting a prescription when they're paying the exact same amount at the LCBO.
So one of the reasons why government gets involved in anything, to sort of legalize it or get into that space, is to take away from the black market. But they've now added this excise tax on top of it, making it, inaccessible to a degree. But this was one of the most significant commitments that the Liberals made during the last election.
The control and regulation of marijuana is done in a way that is responsible and suitable, and that's something we're going to ensure happens once we form government.
And people probably voted for them for this very reason.
Well, and I did, and had I known it was going to negatively affect the medicinal side so much, I wouldn't have been so ready to put my vote there. So it definitely is a punch in the gut at this point. And the thing is, the black market's one thing. That's more on the rec side with the taxes, which again, they're kind of shooting themselves in the foot if they want to eliminate the black market. But on the medical side, we're not losing people to the black market. We're going to be losing people to opioids, which we know is a huge crisis in this country. So opioids are free, and so when you're putting a patient in a position to choose something on their health, and finances are going to be the most thing weighing on their mind, and it shouldn't be like that. They should be making choices for their health.
So Sarah, bottom line though, for the average person that is going to be in a position where they need a medicinal marijuana, or even those for the recreation users, boil it down for us.
Well, I think it sucks. I know lots of med patients who are just not going to be able to purchase anymore. They were already at their wits' end because, like I said, cannabis is not covered insured. Most insurance companies will not. I think Shoppers Drug Mart recently came out a few months back saying that I think Loblaws is another one. But I mean, across the board, their medication isn't being paid for. So on the med side, what's going to happen? They're just going to go back to harsher medications or not at all. And on the rec side, I think, we're going to see the black market flourish a little bit. I think it's the tax on medicinal marijuana it's unjust and it's unethical and it's terrible. But I think we're also going to see a huge pushback. And don'ttaxmedicine.ca is a big initiative that CFAM has put on. They're proponents for medical cannabis patients. And so if people go there and send their emails, they have it set up in a really quick and easy way. Hopefully we can get the taxes, all taxes. There should be no taxes on medical cannabis.
All right, Sarah, I have no doubt that you will be writing more about this as our marijuana columnist. So thank you very much for your time.
Thank you so much.